My name is Karen Armstrong. I'm a public health practitioner for the North East and North Cumbria Public Health Prevention in Maternity team. This presentation is going to cover the resources that we have developed to help you as a GP when carrying out the 6 to 8 week postnatal maternal health review. This slide gives a brief overview of the programme's ambitions and priority areas. I'm sure you're all aware we are now trying to focus on work we can do upstream through prevention as recognised by the programme's ambitions. All the work we have developed and co-produced takes into account health inequalities, and some examples of these are highlighted within the blue box. This slide summarises actions to date. We carried out a scoping and mapping exercise looking at postnatal care provision from the birth of the baby up to the 6 to 8 week postnatal maternal health review. Following on from this, we worked with colleagues across the North East and North Cumbria to develop the resources and training as shown on this slide. It is important to highlight that the 6 to 8 week postnatal maternal health review template and the pre-review questionnaire have been co-produced and developed with primary care network colleagues in North Cumbria, and we've adapted accordingly for rollout across the region. We will be discussing and looking at these resources throughout the rest of the presentation. This slide shows the North East and North Cumbria integrated care system handover and transfer of care standard operating procedure. This was developed to assist professional communication between the birth of the baby and the period up to the 6 to 8 week postnatal maternal health review. Please take time to pause the slide, to zoom in and take on board the information within the document. This slide shows the North East and North Cumbria integrated care system planning a pregnancy infographic, which is a resource designed to help professionals by enabling them to share with and signpost patients to reliable preconceptive information. This slide shows the postnatal pre-review questionnaire. We are aware that some practices may not have a pre-review questionnaire, so have developed this resource drawing on NICE guidance and reflecting feedback gathered from a recent survey conducted by the Maternity Neonatal Voices Partnership. We think the postnatal pre-review questionnaire is a useful tool. Why? Well, because it starts to get women to think about any concerns they may have relating to their health and well-being. It's a signpost to useful information, and importantly, it helps manage expectations regarding their appointment and what to expect. It is important to mention that the pre-appointment health review questionnaire can be added to Accurix or Flory Plus, or it can be printed out and sent to the patient for completion and return prior to the review appointment. This slide is showing the second page of the postnatal pre-review questionnaire. This slide shows the integrated care system 6 to 8 week postnatal maternal health review template. If practices can adopt this template, this will help in the ambition of an equitable offer to mums in the postnatal period across the North East and North Cumbria region. This template has been specifically designed to provide you with access to regional resources and links. The next 3 slides will provide an insight into the rest of the template. Take a few minutes to look over the template. Please feel free to pause this presentation and look at it in more depth. All of these resources will be circulated to you via the GP bulletins. Templates will be available on EMIS and System 1 and are currently published on both systems. In addition, we have developed a resource pack for general practitioners and primary care. Please feel free to share with your colleagues in your practices and across your primary care network and connections. The access to this resource is available on the last slide of this presentation. This slide is called Mum's Suggestions. It shows Mum's suggestions that were gathered during the recent Maternity Neonatal Voices Partnership Survey, which informed the development of the resources discussed in this presentation. As mentioned earlier, this slide summarises the resources I have discussed and the links enabling your access. Thank you so much for taking the time to listen to this presentation, and we hope you will find the advice, guidance and resources provided of real benefit in undertaking future 6 to 8 week postnatal maternal health reviews. Please find contact details for the team involved and their specialisms for any queries you may have going forward.